Hi, my name is Will Lake, and today I'll be presenting a psychological case report on Jordan Belfort from The Wolf of Wall Street. My analysis is going to focus on how Belfort meets the criteria for severe substance abuse disorder, how the culture of the film affects his condition, and a treatment plan. Jordan Belfort is a wealthy stockbroker in New York in the 90s. He goes from lower middle class to becoming head of Stratton Oakmont, which is a really large brokerage firm on Wall Street. Throughout the film, we can see Belfort's life revolving around heavy drug use, money, sex, and fraud. Viewers watch his career, relationships, and character deteriorate as his addiction takes over his life. But of course, this is all normalized through Wall Street because all the other stockbrokers he works alongside are stuck in the same habits as he. The most accurate diagnosis for Jordan's condition is severe substance use disorder. In his case, this primarily involves cocaine and alcohol. Substance use disorder includes patterns of impaired control, social impairments, tolerance, and withdrawals. In this film's culture, I would say that a therapist would probably minimize or overlook Belfort's symptoms because heavy drug use is so normalized within the brokerage industry. Since he's so successful and believes his life is great, I don't see any reason that he would even consider seeing a therapist about his condition. Although substance use disorders are recognized globally, deciding if it is a problem or not completely depends on the culture of the situation. Some cultures view the overconsumption of drugs and alcohol as acceptable, while others refuse to allow even minor amounts. The diagnosis definitely exists, but it's just up for interpretation. For example, the empirical paper called Stigma, Social Inequality, and Alcohol and Drug Use, written by Robin Room, further explains that alcohol norms differ dramatically across societies, stating that addiction can be viewed as a health issue and/or a moral failing, depending on the environment. Jordan's behavior is clearly accepted in his environment, but would be very frowned upon by others. The first symptom Jordan shows is continued use despite serious consequences. This symptom is stated in the DSM-5. He continues to use drugs after car accidents, legal threats, and fights with his wife. A clear example would be the scene where he decides to drive while very clearly impaired, putting himself and others in danger. The second symptom is tolerance and withdrawal. Jordan needs very large doses of his drugs to get the same high. When he stays sober, he's very irritable and can't function as well. One symptom that Jordan does not have is social withdrawal. I read an empirical paper by Colleen Hanlon, and it explains that many people with substance use disorder withdraw from others, but Jordan surrounds himself with people and parties. Isolation is clearly not one of his problems. The best treatment plan for Jordan's substance abuse would be cognitive behavioral therapy and long-term residential rehab. Getting him out of Wall Street would be the best idea for him. Cognitive behavior therapy is one of the most empirically supported treatments for substance use disorder and helps restructure addicts' thoughts and behaviors that are tied to cravings. Cognitive behavioral therapy significantly reduces relapse and increases one's ability to avoid relapse. There are a few ethical challenges with Jordan seeking medical help with his addictions, like trying to determine whether he's seeking treatment for himself or doing it for legal advantages. There are also a few barriers that would be seen through Jordan's treatment, one of which is his wealth, which would hide him from the consequences of drug use, and how his social circles reinforce his addiction. These factors would cause Jordan's motivation for the treatment to be very low, and also if the treatment works and he goes back to the same environment, relapse would be very likely. I would say that the disorder's portrayal is partially accurate because the film realistically shows the growing tolerance with Jordan's drugs, his reckless behavior, and the serious impairments. However, certain scenes are very exaggerated for dramatic effect. Movies like this kind of glamorize drug use and make the addictions look exciting and lighthearted when in reality it's a problem that can destroy your life. Thank you for your time. Here are my references.